Here we've got loads to get through. I mean, Faith and I have been worrying really about not having enough time because we can talk for England around this. We're very passionate about this area and we're really excited to be able to share that with you. But before we start today, we wanted just to hand you over to Jacqueline because she is your representative in Northern Ireland, so she's going to give you a little bit more of kind of an overview of the work that she does to support you guys. And anyway, I'm going to hand over to you, Jacqueline, because you can introduce yourself better than I can.
Thank you, Emma. Hello, everyone. Lovely to be here on midweek lunchtime with you. So I am Head of Policy and Influencing for NDCS in Northern Ireland. So unlike Emma and Faith, my role's a little bit different. It's about really making sure that Northern Ireland government and statutory agencies are delivering the highest standards in law, policy and services for deaf children, young people and families across Northern Ireland. In terms of our work, we're leading deaf charity for deaf children and families. We provide a helpline service for families and children and deaf young people up to the age of 25. We can provide advice and guidance support, particularly where issues family are facing may take a longer period of time to resolve. So some of the issues families are in touch with us most about: special educational needs, access and quality of support and provision in a whole range of settings across education, disability benefits and supporting families to make sure they're accessing all the entitlements that they are able to, and also support around accessing audiology services and understanding what might be happening at audiology for their children, and what that means for families, and making sure they're getting the highest quality support. We also provide training for families as well as information and training for professionals, and we support local groups in Northern Ireland. In terms of And we also nearly forgot one thing there. We also deliver family sign language classes for children and their extended families. So that's not just immediate families, that can be other carers, grandparents, aunts and uncles, older siblings, all involved in that. In terms of deaf children in Northern Ireland, you won't be surprised that we don't have fantastic data in Northern Ireland, but we do know there are at least 1,603 deaf children and young people. We know that the vast majority of school-aged deaf children attend mainstream settings in Northern Ireland. That's 77%. 21% attend special schools, and other children will be attending schools with a resource provision attached, or the specialist school that we have in Jordanstown. We also know that over half of deaf children in Northern Ireland have mild or moderate levels of deafness. It's about 56%, and then 16% around severe or profound deafness. We also know that in Northern Ireland, we have a higher level of deaf children with an additional special educational need than other parts of the UK, sitting at around 36%. So that's just to give you a sense of an overall picture, and we would just emphasise that while that can often be understood as low prevalence, that does not mean low need. That the really high level of specialism and high quality support is absolutely key for deaf children wherever they're living in Northern Ireland. So enough from me, because it's Faith and Emma you're here to listen to today, and I'm going to hand over to them now. Thank you.
Okay, I'm just going to share the slides.
Brilliant. That's great, Faith. I can see that. So I think we're good to go. Do you want to click on to the next slide, and then because we've got the overview of what we're going to cover today. Perfect. Thank you. So we are here today to talk about deaf children and their mental health and emotional health and well-being. And we are going to just touch on a couple of quite recent and very relevant studies that have actually looked specifically at what the prevalence of mental health issues might be and are for deaf children. We are going to spend quite a lot of time talking about early relationships and attachment, because I think that's kind of like why we're here today, really. I think all of us are really passionate about those very early years and what goes on for families. And I'm, because I don't know you guys well, I don't know what your background or your knowledge is. So I probably may be giving you some information here that you already know, or you might not know, but just bear with me. But I think what is important to understand from our perspective is that deaf children have, this is kind of almost like a gift, that they are identified very early, and many deaf children are identified within those first few weeks of life with their deafness. And for us that support and work with them, that is a gift, because it allows us to get in and work with those families and form those relationships and support those families right from the very earliest days, where I know many services may not be seeing a child until, many years into their life, or, the identification for some, conditions comes along much later. So deaf babies will go through the newborn hearing screening procedure, and if they have an identified deafness, within perhaps a few days of that deafness being identified, early intervention services should be triggered, and that will normally be a teacher of the deaf. But for families, this is a bit of a double-edged sword, and I think this is what we're going to talk about, because yes, they will often say back in, when they reflect on their experiences, they want to know early that their child is deaf, because then they feel that this is a chance for them to be able to maybe, support and do things a little bit differently. But it also comes at a time when they've just had a baby. There's a lot going on for them, and it can sometimes get in the way of them feeling that they can parent normally, in inverted commas, whatever that means. So there is something there that we have to unpick and acknowledge, that as professionals, we may be, incredibly privileged and excited that we can be there right from the beginning of their journey. But for them, we've got to be really aware of their landscape and what their emotional landscape looks like. And Faith's going to talk a little bit more about what that landscape can be and where those challenges may be for those families in the very early years. We're also going to talk a little bit about language and communication. This is a really important one for deaf children, because we know that good mental health and language and communication are so closely linked, really closely linked. And for those children and young people who have well-developed language and communication skills, often that will then support their mental health. Deaf children do have the kind of a bit of a double whammy. They may struggle to access a really great quality spoken language environment because of their deafness and other factors around them. And they may also struggle to access a really good signing, so a BSL or ISL environment, for different reasons, but the impact is the same. So they may have more mental health issues that are impacted by poor or delayed or less well-developed language and communication skills. And then we're going to, finally, we're going to look at this a lovely resource that we have partnered with Anna Freud, and I'll give you a bit more information about Anna Freud in the next slide, who are a mental health charity, which is for professionals working with deaf children and their families in the early years. So it's been specifically written to look at all of those things that we're going to talk about today, and how we can make the environment and the communities that our deaf children and families live in a more positive and a place where they can learn and grow and be accepted for who they are, and we can have high aspirations and achieve the best possible outcomes. Next slide, please, Faith. So Jacqueline has given you a little bit of information about who we are and what the cohort population of deaf children is in Northern Ireland. And I just wanted to draw your attention to Anna Freud because they are a fantastic mental health charity, and they have a beautiful part of their website is just designated towards looking at mental health and emotional well-being for children 0 to 5. They've got information on bonding, on self-care for families, on promoting self-regulation, and loads of resources also for professionals and practitioners in nurseries and settings on things like neurodiversion and emotional development. So if you do get a chance, also go onto the Anna Freud website and see what they've got to offer there. Okay, next slide, please, Faith. Okay, I'm just going to give you a minute to read this beautiful quote. It's just lovely. So, yeah. So I think this is our starting point for today, really. Positive deaf identity is key for all our children and their families, and it's also key for good emotional health and well-being. It's our starting point and it's our ending point, and it begins from the moment that deaf child is identified as deaf. It looks different for every deaf child and their family. So we know that the deaf population is hugely diverse, and every child and every family will experience their deafness differently. And it is always a journey. Okay, do you want to, can we go on to the next slide, Faith? So we're here today because we know that deaf children and young people are more likely to experience poor mental health and difficulties with their emotional health and well-being. And we've known this for years and years and years. And anecdotally, this is well and, you know, it's frequently discussed. And we also know from our services that this is a well-recognised area that we need to support with and be aware of. And there are 2 studies that have been done relatively recently, one in Northern Ireland, which came out of Queen's University Belfast and was led by Bronya Byrne and Catherine, I think. Yes, Catherine McNamee. I'm not sure if I pronounced her name right, so apologies if I've got that wrong. And they looked at the emotional well-being of deaf children and young people, and utilised a bigger piece of work that had been done in 2022, looking at the mental health of the Northern Ireland population of young people and children. And they came up with 2 key findings. One was that deaf children are more at risk of developing depression, anxiety, generalised anxiety disorder, OCD, panic disorder, and separation anxiety disorder compared to hearing children, and that almost 21% of deaf children reported having at least one psychological condition compared to only about 12% in the general population. And the second study was one that we supported with and was carried out at the University of Manchester. I think it started in 2020 and finished in 2023. And this looked at the population of young deaf people, 16 to 19-year-olds across England, Wales and Scotland. So not Northern Ireland, but England, Wales and Scotland. And it was called the READY study, which stands for Recording Emerging Adulthood in Deaf Youth. And they also really found very, very similar findings to the Northern Ireland study, which was that deaf young people had much lower wellbeing scores than the general population. And more had low well-being and fewer had high well-being. They also found that it didn't really matter where, what type of deafness the child had or the young person had, what group they came from, whether they were disadvantaged. None of these actually, there was no particular group of deaf children who came out with lower scores. It was across the board. And I think what they also found, which is really interesting, is that these children scored really low on self-determination. So self-determination is those skills and traits that mean that a person is able to decide what they want and act to achieve it. And it includes those kind of skills around decision-making, goal setting, planning, problem solving, self-advocacy, and self-management. So that was also very low in this group of children. So we know that deaf children are going to be more at risk of poor mental health, but we also know that we can make a difference in those very early years, because this is where we lay those foundations for good emotional health and well-being. And supporting and working with families is key to this. 90% of deaf children are born to hearing families, and deafness is low incidence. And we also know that for many deaf children, they may be the only deaf child in their community or in their setting. So there isn't that bigger group from which to learn from or to gain support from. Okay, next slide, please. Faith. So thank you. When we work with Faith and I support with, we have a wonderful, I don't know if you know about our newly diagnosed program and our early learning program, but we provide training and support to families with newly diagnosed babies or babies in those first 2 years of life. And one of the things we're really, really passionate about is early interaction. And because we know that positive early interaction, that kind of reciprocal and responsive parenting, is that building block for healthy attachment. And we also, I think I've said that a bit earlier on, we're also really aware that deafness can get in the way sometimes of parents feeling able to just be themselves and to just parent naturally. And Juliet talks, we're going to show a video towards the end of this presentation where a mum talks about exactly that, and feeling like she doesn't really know her baby. And we also know that those, getting those early interactions, going, getting those families feeling really comfortable and confident, builds those really important relationships with mum, those primary attachments that are so key to later healthy development. It models how to form relationships so that babies can go on to form other relationships with others outside those sort of secondary attachments, we call that. And also there's early interaction is absolutely key for those later language skills. So again, sometimes our families get quite caught up with, should my child be doing spoken language? Should my child be doing British Sign Language? Should my child be learning ISL? What are they doing with their words? What are they doing with their signs? And sometimes we just want them to take a step back and say, what you're doing with your communication, how you communicate, how you create that deaf aware, environment is so much more important than just those, whether they're going to produce words or signs. That will come, but if you can get this first bit really embedded and really, working well for you in a playful, positive way, then the rest will follow on. The foundations will be there. Okay, I think I'm handing over to you now, Faith.
Thank you, Emma. Okay. So early relationships and attachment. So caregivers, we know this, caregivers are the internal working model for how relationships should work. What happens in the earliest years within these relationships really matters, and we are well versed in this. These early experiences pave the way for the future and children's understanding of closeness, security, love, safety, and relationships with other people. So for deaf children, these relationships are a huge protective factor for future well-being. But what happens when a parent finds out their baby is deaf? Firstly, and to be really clear, no two parents are the same. So it would be wrong to suggest that all families struggle when it's discovered that their child is deaf. For parents who are deaf themselves, actually having a deaf child can be really welcome news and very celebrated. On the other hand, there are families who will struggle to receive this information. And remember, 90% of deaf children are born to hearing parents, 90%. And those hearing parents often have no prior experience of deafness. They don't know another deaf person, they're not connected to a deaf community, they're unsure and in the dark about what will happen next. So deafness can disrupt the early bonding experience for a wide variety of reasons. And there are families who, for having a deaf child, this will place a strain on family functioning. This can be for all kinds of different reasons. So for some families, deafness brings with it stigma or negative feelings and opinions about disability. Families may struggle with multiple appointments and feel like they don't know how to parent. When you've got so many appointments and so many people telling you what's best, what to do, who to speak to, what's going to happen now, the actual kind of mechanism that kicks in that you are the parent can be a little bit lost, and you forget that actually you know your child better than anyone else, and you are their most important educator, biggest champion. That can sometimes get put to the side, and parents forget about or worry about how to parent. The terminology and technology around deafness can be a barrier to feeling close to their children, to their deaf child. And family members may have diverse or differing attitudes towards deafness. For example, a grandparent who doesn't want their child to be seen with their hearing aids in when they're out and about. We had a family that we spent some time trying to support. They'd get to the bottom of the drive with baby in the pram with hearing aids in and suddenly feel embarrassed and upset, take the hearing aids out. Instantly you've limited their access to language, to sound, all kinds of kind of knock-on effects of that. All of these things can create stress and anxiety at a time where you're really trying to be together and connect. So in our experience, this can cause a lot of parents to skip to the end. They think about far off milestones far earlier on than other parents do. So for example, people start to worry very soon about whether their child's going to get married. Is their child going to go to university? Are they going to be able to drive a car? Of course, a deaf person can do all of these things, but when these worries overwhelm and concern parents, it's really hard for them to focus on the here and now, on enjoying the moment with their baby. And parents will tell us when their child's much older, I wish I could go back to when they were in their early years. I wish I could just enjoy them for who they were then. A lot of families might start to second guess their natural communication approach and wonder if they're doing the right thing. Can they hear me at all? Is it worth singing? Should I be reading stories? I've read stories to my baby bump like you told me to for all of this time, and now you're telling me they're deaf. Was it worth it? Did I do the right thing? All of these things going around in our parents' head. I can't get very good eye contact with my baby. How do I engage? And these hearing aids, how do I keep them on? They keep coming off. Are they in properly? Should I be interacting before they're in? All of these things are so stressful. And when you're holding your baby and they've got hearing aids in, the feedback sometimes when you're trying to have that really lovely close moment of feeding and hearing aids are squeaking and giving feedback. I'm a deaf grown up. When I give people a hug, I have a lot of squeaking going on from the feedback from my hearing aids, and all of these things disrupt or cause concern for families. So there are lots of things that can get in the way. Deafness might also not be the only thing going on for a family. So we recently partnered with the National Children's Bureau to develop the Sharing Real programme for families with deaf children. And we worked in areas of disadvantage and deprivation to deliver the programme. And we really quickly learned that these families were battling issues far greater than their child's deafness in that moment. Issues around poverty, around access to services, and so many other things. And it made deafness fall down their list of priorities. It didn't mean that they didn't care. It just meant that there wasn't capacity right now in this moment for this family to really put deafness front and centre of what was happening. Deafness can add a layer of complexity to what is already a complex situation for many families, and we need to hold that in mind when we're coming alongside families with deaf children. Okay, so I'm just going to read this from the slide. So the parent's face and body are like a mirror to the baby. This very early mirroring process, which can reflect the parent's acceptance, forms the basis of the baby's self-concept. The parent's responses are the first brush strokes for the developing picture. I really love this quote. I think it's very, very lovely. But the statement is hugely significant in our journey with families of newly diagnosed deaf children. It's all about acceptance and how this acceptance is the beginning of a baby forming a view of themselves. So self-concept is the beginning of identity. We learn who we are from other people and the way they respond and react to us. How do they behave when they're around us? How does this help me know who I am? Identity is an internal picture of who we are, and it's built over time and it's reflected back to us from other people. Our emotional health and well-being is affected by how accepted we feel. I'm sure we've all been in situations where we've not felt accepted. We feel a bit on the edge, and actually, how does that make us feel? Our identity grows as we grow, and deaf identity is no different. So for many young people that we've worked with, they tell us that having a strong deaf identity is important to them and to how they feel about themselves. But how do you build a deaf identity? So there is no tick list, there is no magic recipe to build a strong deaf identity because everyone is different. Every deaf person is different. My deaf identity is very different to my colleagues at work. I lost my hearing at 16, so my deaf identity is newer than other people's, and it evolves and changes over time. But there are things that can strengthen a deaf identity, and they might be things like having deaf role models from a really early age, spending time with other deaf people, being exposed to spoken language and signed languages, seeing yourself represented in the things around you, like books, like toys, TV programs. But one of the biggest things that we often overlook is the language that's used about deafness and around deaf children. The language we use is powerful and can easily slip into negativity through a lack of awareness. So being positive in our language around deafness and in front of families and with colleagues and other professionals is really important for children's deaf identity. If you think of the list that I've just reeled off, being a hearing parent of a deaf child with no prior experience of deafness might actually make creating a deaf identity quite challenging. And that's where you as professionals can support and often be the link for families, particularly when it comes to the use of, the power of our language and really building children and families up, having high aspirations for deaf children and helping families, parents to do the same. Okay, so I'm going to quickly just talk to you about the actual toolkit that we developed alongside Anna Freud, Deafness and Me. It's a really practical resource. It supports those working with deaf children in the early years, and we wanted it to be a pick up and go resource. It includes everyone, it's really easy to use, simple and straightforward. So it's designed with lots of activities to guide practitioners in supporting deaf children to understand things like feelings and emotions. It also encourages people working in the early years to reflect on their quality everyday interactions, as we know that these are the basis for strong and meaningful attachments and also successful social experiences and learning for deaf children. So those working in the early years are uniquely placed to promote and develop the foundations of language, and supporting supportive language and learning environments, whether they're spoken or signed. Thinking about emotional literacy, social problem solving with other children in everyday life. That's what's happening in the early years. It's starting right from the beginning. So we've tried to encapsulate all of that in this toolkit. So the toolkit is split into 3 sections. So we've got creating a sense of belonging and deaf identity. This really focuses on having a powerful sense of self, positive identity as a deaf person, but also as a valued member of the wider community. It begins in a place where the child feels known and accepted. It's that acceptance that builds identity, that strengthens our emotional well-being. So creating a sense of belonging is section 1. Section 2, helping the child to learn from relationships and be social. So supporting early attachments that build resilience, self-esteem and good mental health. And by knowing about and holding the needs and possibilities of the deaf children in our care in mind, we can support attachments with primary carers and provide crucial secondary attachments for deaf children, helping children to form relationships and enjoy them. And number 3, supporting the child to understand feelings and emotions, allowing children to practice standing in the shoes of someone else and seeing things from a different point of view. And we know this is something deaf children sometimes develop a little bit later than their hearing peers. So really thinking about developing empathy, emotions and feelings. And then the activities. So the activities are really clear. They're set out in exactly the same way and they link to each of those 3 areas. So this one is about sign names. So you've got the introduction, a little bit of context. Then we've got the activity. So my sign name is Faith, which is like praying hands. And in the deaf community, people have sign names and they're given to you. Part of your personality, they reflect who you are. They've got a friend at work called Gavin and his sign name is like this, because he has spiky hair that runs right down the middle of his head. So for children in the early years, developing a sign name is really exciting and you're thinking about who you are, what characteristics do you have, what characteristics do your friends have. It's a really, really lovely activity to do together. It's simplified and extended so that you can use it in different ways. And it also has top tips for your communication environment and developing a language-rich environment in the early years. It's linked to resources. So on our website, if you want to have a look, we've put the links as well in a follow-up email. There's a wealth of resources like this book, Elephant in the Lost Blanket, that kind of reflects deaf characters, deaf representation, things like the finger spelling postcard. All of these resources are linked to the activities in the toolkit and you can find them on the website. So the early years is fantastic and we love it, and it's a crucial time for promoting and developing good mental health and well-being for deaf children. I think we've really covered that and you already know a lot of this too. And what we wanted to do now, if technology will play ball, is to play a video. This is Juliet, the lovely Juliet, and she's going to talk a little bit about her early diagnosis and finding out that her daughter was deaf and actually how that made her feel and her family. And then we're just going to have a little bit of time to discuss what kind of feelings the video might have stirred up in you, and experiences of working with families. So keeping everything crossed, I'm going to press the magic triangle and we'll see what happens.
There are 5 of us in our family, me, my husband, and Rosie, who's our eldest daughter. She's 10. And then I have twins who are aged 8, and they're called Ellen and Beth. And Beth is profoundly deaf. So both my twins were born 3 months early at 28 weeks. So we think that was the reason why Beth was deaf, because she hadn't quite developed all the bits in her ears to enable her to hear. So she also has a condition called auditory neuropathy spectrum disorder, whereby the auditory nerve in between her ear and her brain isn't quite developed enough and is a bit damaged. So it just means not enough signal is going up there when she hears. She wears cochlear implants. She was implanted when she was 2. I probably thought something that was wrong with her. You know, if she was deaf, there's something wrong. I've come to realize since then that there's nothing wrong with being deaf. At the time, I felt negative thoughts. I felt guilty because I thought it was my fault. Because she'd been born early, I thought that must have been something wrong with me for her to have been born early. And the reason she's deaf is because she was born early. So at the time, I felt a lot of guilt, and I felt maybe a bit of grief in terms of how is she going to develop as a child, as an adult? All these things that sort of went through my mind. Because I had an older daughter who was hearing, who was 2 at the time, I knew what it was to interact with her and bring her up, but I was completely in the dark about how I would even communicate with my daughter who's deaf, and felt a bit lost about how would I ever find that out, and how would I bond with her. I found it harder to bond as a parent with her than with her twin at the time, because she wouldn't respond to any sound. She wouldn't respond to my voice. She wouldn't really give me much eye contact, which did improve as she got older, as I learned through amazing people like the teacher of the deaf how eye contact is so important in communication.
So I think I probably first went to my husband. I talked to him about how I was feeling, or friends of who were parents of other deaf children.
When I met more people who had children who were deaf, other parents, and when I met other adults who were deaf, who signed, who spoke, who used all sorts of different communication, it opened up a completely new world for our family in realizing that this is normal. There are other people out there like me who have children who are deaf, who are going through similar things that I was. So that was really empowering.
I think the main positives have been finding out about something completely new that I would never, ever have thought I'd know about, which is deafness. Learning about how incredible children are generally, in that they can do anything, even if they're deaf. It's not a barrier to anything that they can do or should be able to do. And being able to tell other people about that, I think that's the positive thing, being able to share that with loads of different people, family, friends, professionals. And as a parent, you have so much strength and positive kind of vibes that you can give other people, in that you're there firsthand looking after your child. You're the one that knows them the best. And any professional will say, or should say, a parent knows their child the best. And I've really learned that, because their needs change over time, and you're the best person to know what they need out of anybody, which I think is a really positive message to be able to give other parents about any uncertainty they may have. Another positive thing is having met so many amazing families and parents.
Okay, so I'll stop Juliet there, and I'll just stop the share as well, if that's okay. I think we're probably at the end of the presentation.